Do you struggle with persistent lower back pain? That dull ache in the morning? The sharp twinge every time you bend down? Maybe you've tried painkillers, stretching routines, even changed your mattress. But there's one powerful factor you may be overlooking: what you eat every day. Welcome to today's video. We're diving into 10 natural foods that can help reduce lower back pain safely and effectively without relying on pills. This isn't just internet advice. It's backed by real science, rooted in how your body works, and used by health professionals to manage chronic pain. So if you're ready to understand what's really going on with your back and how your next meal could be part of the solution, stick around until the end. You might be surprised at the healing power hiding in your fridge. Number 10. Fatty fish. You wake up with a dull ache in your lower back, stiff from the night before. You might assume it's just your mattress or posture, but what you ate yesterday could be part of the picture too. Fatty fish like salmon, mackerel, and sardines are some of the most potent natural anti-inflammatories available in your kitchen. These types of fish are rich in omega-3 fatty acids, specifically EPA and DHA, which help reduce inflammation in the body at a cellular level. Inflammation is one of the most common contributors to chronic pain, especially in the lower back where the spine bears a lot of structural stress. When inflammation in the joints, discs, or surrounding soft tissues persists, it can lead to ongoing pain and stiffness. Omega-3s help balance the body's inflammatory response, much like adjusting the flame on a stove to keep it from burning too hot. Research has shown that increasing dietary omega-3 intake can, over time, reduce the intensity of back pain and improve mobility, sometimes as effectively as non-steroidal anti-inflammatory drugs, but without the gastrointestinal side effects. It's important to understand that food is not an instant cure, but just like a daily medication, the consistent intake of omega-3s can create a protective foundation over time. So, instead of reaching for ibuprofen each morning, consider adding grilled salmon to your lunch rotation a few times a week. It's a small dietary shift that could ease inflammation from the inside out. Pain relief isn't just about pills. It's about understanding your body. Number 9. Tart cherries. Maybe you've noticed your lower back throbbing more after a long walk or a stressful day. You might stretch, apply a heating pad, or lie down, but you probably wouldn't think to reach for cherries. Tart cherries, especially in concentrated juice form, are remarkably high in antioxidants called anthocyanins. These compounds don't just give the cherries their deep red color, they also help fight inflammation and oxidative stress, both of which are implicated in chronic pain. Oxidative stress is like rust forming on the body's tissues. It accumulates over time, particularly in areas with wear and tear, such as the lumbar spine. When these tissues break down, the nerves surrounding them can become irritated, leading to persistent pain signals. Studies have shown that individuals who consume tart cherry juice regularly report reduced muscle soreness and joint pain, including in the lower back. It's often used by endurance athletes to speed up recovery, but the same principle can help anyone with chronic musculoskeletal discomfort. It's important to differentiate tart cherries from sweet cherries. Tart cherries, like Montmorency cherries, have higher levels of anti-inflammatory compounds and lower sugar content, making them a better choice for therapeutic purposes. If you're dealing with lower back pain that flares up after activity, a daily serving of tart cherry juice may help calm the inflammation and support your recovery. So if this symptom sounds familiar, it's time to take it seriously. Number 8. Leafy greens. You've been told to eat your greens since childhood, but few people realize how directly vegetables like spinach, kale, and Swiss chard support spinal health. Lower back pain is often rooted in more than just muscular strain. It can stem from nutrient deficiencies that weaken the supporting structures of your spine. Leafy greens are rich in magnesium, calcium, and vitamin K, all of which play vital roles in bone density, muscle function, and inflammation control. Magnesium, in particular, is essential for proper muscle relaxation. Without enough of it, muscles can become tight, cramp more easily, and even irritate nearby nerves. This is especially relevant in the lower back, where tight muscles often exacerbate pain caused by disc degeneration or sciatica. Additionally, the vitamin K in leafy greens helps regulate calcium placement in the body. Rather than allowing calcium to accumulate in soft tissues or arteries, where it can cause problems, vitamin K directs it into the bones, strengthening the spine and preventing fragility. Leafy greens also provide fiber, which supports gut health, and there's growing evidence that chronic inflammation may be linked to imbalances in the gut microbiome. So in this case, a salad isn't just helping your digestion, it could be subtly improving how your body manages pain overall. The nutrients in your meals can do more for your back than most over-the-counter medications. Number 7. Turmeric. You've probably seen turmeric in golden milk lattes or as a bright orange powder on your spice rack. But beyond its culinary appeal, turmeric holds a powerful secret. It contains curcumin, a compound with well-documented anti-inflammatory properties. Chronic lower back pain is often driven by ongoing inflammation in the tissues surrounding the spine, whether that's inflamed facet joints, irritated nerves, or stressed ligaments. Curcumin works by targeting the molecular pathways that trigger inflammation, particularly by down-regulating cytokines and enzymes that fuel the inflammatory response. What makes turmeric especially compelling is that, unlike many pharmaceuticals, it doesn't suppress the immune system. Instead, it helps modulate it, reducing unnecessary inflammation while allowing the body to continue defending itself against true threats. Several clinical trials have demonstrated turmeric's effectiveness in managing pain conditions like osteoarthritis, which shares many inflammatory features with degenerative disc disease in the spine. In some studies, curcumin performed as well as common NSAIDs, with fewer gastrointestinal risks. One caveat: curcumin isn't easily absorbed by the body on its own. That's why it's often combined with black pepper extract, which contains piperine. This increases absorption dramatically. If your lower back pain tends to flare in the mornings or after long periods of sitting, adding turmeric to your daily meals or considering a high-quality curcumin supplement with piperine may help reduce stiffness and discomfort over time. Your spice cabinet might be more powerful than your medicine drawer. Number 6. Berries. You notice that some days your back feels worse after a poor night's sleep or during periods of high stress. While stretching or massage might help in the moment, what you eat during those times can either fuel or soothe your body's response to pain. Berries, such as blueberries, strawberries, and blackberries, are rich in polyphenols and antioxidants that protect the body from oxidative damage. When your body is under stress, it produces free radicals, unstable molecules that damage cells and contribute to inflammation, especially in areas under physical strain like the lower back. The antioxidants in berries neutralize these free radicals, protecting tissues and supporting your body's natural healing processes. They also enhance the function of the endothelium, the inner lining of your blood vessels, which improves circulation. Better circulation means more oxygen, and nutrients can reach spinal tissues, speeding recovery and reducing pain. Emerging research even suggests that diets high in berries may help regulate inflammatory gene expression. In other words, berries might help quiet the volume on pain signals being amplified in the nervous system. You don't need to consume exotic superfoods to reap these benefits. A simple handful of mixed berries in the morning or as a midday snack can serve as a consistent anti-inflammatory defense. Small daily choices can compound into meaningful relief. Number 5. Ginger. You may associate ginger with easing nausea or settling your stomach. But this root has another important property. It's a natural analgesic and anti-inflammatory agent, which makes it especially relevant for managing lower back pain. Ginger contains compounds called gingerols and shogaols, which have been shown to reduce the production of pro-inflammatory cytokines, the same types of chemical messengers involved in chronic musculoskeletal pain. These compounds function similarly to nonsteroidal anti-inflammatory drugs, but without the same risk of ulcers or kidney strain. For individuals dealing with lower back pain due to soft tissue strain, repetitive motion, or early-stage arthritis, ginger may help reduce the inflammatory response that leads to swelling and pain. It can also support improved blood flow, which is crucial for delivering nutrients to damaged tissues and removing waste products that contribute to soreness. Some studies have found that individuals who consume ginger daily, whether in tea, grated into meals, or taken in capsule form, report reduced pain and improved function over time. It may not be a quick fix, but it's a safe, gentle tool for long-term pain management. So if your lower back tends to tighten up by the end of the day, try sipping ginger tea after dinner. It's a simple act that could help relax your muscles and reduce inflammation while you sleep. Natural relief often begins with consistency, not intensity. Number 4. Walnuts. You bend down to pick something up and feel that familiar tension in your lower back again. It's frustrating, especially when the pain seems to return without warning. But what if part of the solution was in your pantry, specifically in a small handful of walnuts? Walnuts are an excellent source of plant-based omega-3 fatty acids, particularly alpha-linolenic acid, ALA. Although ALA is slightly different from the EPA and DHA found in fish, it still plays a meaningful role in managing inflammation throughout the body. Chronic lower back pain often involves ongoing, low-grade inflammation in the joints, discs, or surrounding connective tissues. While medications can temporarily block pain signals, they don't change the inflammatory environment itself. That's where foods like walnuts come in. They support systemic anti-inflammatory pathways and provide essential nutrients like magnesium, fiber, and antioxidants that protect cells from oxidative stress. In addition to their anti-inflammatory benefits, walnuts help stabilize blood sugar levels and support vascular health, both important factors in pain management. High blood sugar and poor circulation can contribute to tissue damage and prolong healing in injured or overused areas of the spine. And let's not forget, inflammation isn't isolated. What's happening in your lower back often reflects larger patterns in your body. Choosing anti-inflammatory fats, like those in walnuts, can shift that pattern in a more healing direction. So instead of grabbing a processed snack or another cup of coffee during your afternoon slump, reach for a small serving of raw walnuts. They may be doing more for your back than you realize. Food isn't just fuel, it's information for your body's healing systems. Number 3. Avocados. Maybe you've been told your lower back pain is due to a bulging disc or wear and tear, and it feels like a diagnosis with no clear solution. But when we consider the role of nutrition in tissue repair and inflammation, certain foods begin to stand out, like avocados. Avocados are rich in monounsaturated fats, which have been shown to reduce inflammation and improve joint health. But they also contain important micronutrients like potassium, magnesium, and B vitamins, all of which are involved in nerve function, muscle contraction, and tissue healing. Lower back pain isn't always just about bone or disc degeneration. In many cases, irritated or compressed nerves are a significant factor. Magnesium and B-complex vitamins help support nerve health and reduce nerve hypersensitivity, which can make pain feel more intense than the underlying damage would suggest. What makes avocados particularly helpful is how they combine healthy fats with fiber and anti-inflammatory compounds like phytosterols and carotenoids. This unique profile supports both metabolic and structural healing, calming inflammation while nourishing tissues. Unlike processed foods that often spike inflammation, avocados offer a steady source of energy without contributing to blood sugar swings or inflammatory load. Think of them as a nutrient-dense building block for your spine's long-term health. Whether sliced into a salad or mashed on whole-grain toast, avocados are one of the few foods that nourish both the nervous and musculoskeletal systems. Supporting your spine starts with feeding the systems that protect it. Number 2. Green tea. You might feel that mid-afternoon stiffness setting in, especially if you've been sitting for hours. It's tempting to reach for a pain reliever or another cup of coffee, but green tea might offer a gentler, more supportive option. Green tea contains powerful antioxidants called catechins, with epigallocatechin galate, EGCG, being the most well-known. These compounds help reduce inflammation and oxidative damage, especially in tissues under mechanical stress, like the lower back. One of green tea's lesser-known benefits is its role in modulating inflammatory pathways at the genetic level. It doesn't just suppress symptoms, it helps your body regulate the very processes that lead to chronic pain in the first place. For individuals with degenerative disc disease, arthritis, or chronic myofascial tension, green tea's polyphenols may support healing and reduce pain sensitivity over time. Additionally, green tea supports better circulation and hydration, both essential for keeping the intervertebral discs healthy. Unlike sugary sodas or caffeinated energy drinks, it hydrates while providing a gentle energy boost without the inflammatory baggage. Drinking 2 to 3 cups a day, especially in place of other caffeinated or sweetened beverages, can be a quiet but powerful way to reduce your body's inflammatory burden and support long-term spinal health. When it comes to pain, what you drink can matter as much as what you eat. Number 1. Water-rich vegetables. It's easy to overlook hydration when thinking about back pain, but if your lower back feels stiff, achy, or more sensitive in the mornings or after sitting for long periods, it's worth asking, are you giving your spine the hydration it needs to function? The spine is made up of vertebrae separated by intervertebral discs, soft, gel-like cushions that absorb shock and allow for flexibility. These discs are largely composed of water. When your body is even mildly dehydrated, those discs can shrink, become less effective at absorbing impact, and place more pressure on the surrounding joints and nerves. That's where water-rich vegetables come in. Vegetables like cucumbers, celery, zucchini, and bell peppers have a high water content along with fiber, antioxidants, and important minerals like potassium and magnesium. This combination not only helps hydrate your tissues, but also supports electrolyte balance, reduces muscle cramps, and aids in flushing out inflammatory waste products. Unlike drinking plain water, which is essential, but can pass quickly through the system, water from vegetables is absorbed more gradually. It's paired with fiber and nutrients that help retain hydration in the tissues where it's needed most, including the spine and muscles of the lower back. Think of it as slow drip hydration for your spine. Adding these vegetables to your meals, whether in salads, stir-fries, or smoothies, provides both immediate and long-term benefits for reducing pain and improving mobility. Sometimes the simplest fix, hydrating your tissues, can be the most overlooked. That's all for today. If you found this helpful, consider subscribing. There's more valuable health content on the way.